I will show you one important area in the upper part of the arm, and that area is the delto-pectoral groove. This delto-pectoral groove, it is sometimes asked in the Viva post examination and maybe a short note in the theory examination. What is the delto-pectoral groove? What is the shape and what is the content of this groove? I will discuss. Let us see the groove. This is the groove here. So on each side of this groove there are two muscles. On lateral side, the deltoid, the medial border of deltoid. This is the deltoid muscle. So this is the medial border of deltoid, and this border is the clavicular head. So clavicular head of the deltoid forms the lateral border, and this muscle is the pectoralis major. This one, the whole muscle is pectoralis major. So this part also clavicular head of the pectoralis major. You know the pectoralis major having clavicular head and the sternocostal head. This one sternocostal head. But here the boundary is formed by the clavicular head of the pectoralis major. So this border or the lateral border of the pectoralis major muscle form the boundary or medial boundary of the groove, and lower the two muscle converge, but upper side, this is the clavicle, so there is a gap here. This form the base of the delto-pectoral groove. Then what are the structures forming the roof of the delto-pectoral groove or delto-pectoral triangle? Triangle because in the upper side it is the having the base, but lower side it is the having the apex. So it is triangular, so called it is called the delto-pectoral groove or delto-pectoral triangle. The roof is formed by the skin, then superficial fossa, fat and deep fossa. Then if I reflect that all these structures, we can see the groove and the floor upon which these structures are there. This floor is formed by the clavipectoral fossa. Can you see the floor, this fossa behind? This one is the I am showing you. Yes, this is the clavipectoral fossa which forms the floor of this groove. So now we know the two sides, roof and floor, and upper side and lower side. Then last part is what are the contents of this groove? The main content is the upper part of the cephalic vein. This vein is the cephalic vein, who is going to join the axillary vein after piercing the clavipectoral fossa. If you go deeply, here you see the clavipectoral fossa is pierced by this cephalic vein, and then it joins with the axillary vein. Apart from this cephalic vein, you can see some blood vessels or arteries, and these are the branches from the second part of the axillary artery, and the branch is the acromiothoracic artery, and acromiothoracic artery gives up two important branches, one deltoid branch and the acromial branch. So the acromial and deltoid branch of the acromiothoracic artery will be one of the content of the delto-pectoral groove. Besides this artery and vein, some delto-pectoral lymph node may be there in this position. So if a short note comes on delto-pectoral groove, you have to draw a diagram forming the apex here, base here, then medial boundary and lateral boundary, and then the contents of the groove. So that's all for the delto-pectoral triangle or delto-pectoral groove.